Be smart. Hello, everybody. As y'all come in, very happy to have you guys. If you're listening to this now or you're going to watch it recorded, we're going to have a blast, and we're going to talk about things that are really important in a recessionary time period. How to centralize marketing operations, technology, how to build your in-house team, and everybody that attends, I want y'all to take away something. We're going to do something all with the lens of being in a recessionary period. It's not coming, it's here. We're getting pushback. We have almost entirely PE-backed provider groups, right? And so debt is getting more expensive, which means every dollar's got to count. So this is going to be a different type of roundtable than we had a couple of years ago, where it was growth at all expenses didn't matter. This is going to be all done through a lens of efficiency. How do we get more efficient patients in here? And how do we build a system to track them all the way through? So Marc and Mike have been around the block. These are very experienced marketers. They not only love marketing, they also love business strategy. So everything with the lens of how do we make the business result happen and how do we do it efficiently? Marc, Mike, y'all ready? Get ready. Is it okay if I cue something up and we share? All right, let's do it. Okay, I think I'm sharing this thing, and I think I start our slideshow when I figure out how to do that. Okay. I'm not, here it is. It's hidden behind y'all's beautiful pictures. All right, guys, let's get into it. Mike, Mr. CMO of Haven Health, tell them what Haven Health is and tell them your favorite types of marketing. What are you doing there?
Yeah, sure. So Mike Hulick, I'm the Chief Marketing Officer for Haven Health Management. We own and operate behavioral health, mental health centers across the country. So we're currently in 6 states with 8 brands under management, roughly 400 to 500 patient admissions a month. We manage everything in the marketing department in-house for the most part. Very little do we sub out. Our digital team's in-house, SEO, pay-per-click, pretty much everything you can get at a marketing agency. That's pretty much it. That's it in a nutshell.
Cool, Mike. Cool. Yeah. All right. That's cool. So you don't need agencies. That's fun. Well, this will be good. We're going to hear from Mike. How do you build the in-house team with no agency support? That's pretty cool. That takes, I'll tell you, the biggest trick to that is having a leader that knows how to keep them accountable. So Mike knows a lot about performance marketing if he was able to build that. That'll be cool. Marc, tell them a little bit about yourself. You've had a long track record recently with DSOs, now standing every other. Tell them about it. Don't let me tell them.
Yeah, my name is Marc Heffner. I am the founder of DSO Marketing Xcelerator, and we specialize in offering fractional CMO services to growing dental service organizations needing executive level guidance in their marketing efforts. But they're also resource constrained in hiring a full-time CMO. That's where I come in. I offer my CMO services to organizations that are constrained with their resources, and I want to help them grow. I've come from the DSO industry. I've been in marketing for almost 30 years. So I've seen marketing infancy grow in the electronic media and grow to where it is today, when we're talking about social media and pay-per-click and how we're integrating the customer journey. I remember having conversations a few years ago. It'd be great to know how our patients and our customers are responding to our ads and what we're doing. Today, we have that ability to understand that tremendously. And then it's taking that information and guiding that stuff to make that journey turn into dollars. That's where we're trying to get to. We're trying to grow a business.
I like that. And I think, listen, we have a really noble cause. We really are trying to help patients access care, right? We all care about it. That's why we all chose this path. But at the end of the day, turning the journey into dollars, I'm going to steal that. That's phenomenal. That's what counts. I'm going to use that internally here at Cardinal. We have to generate revenue with all of our activities, and you can track it. And I can't tell you how many times I get with consult with a practice, and they've gotten big by referrals, by accident, by good management, by delivering good care, but they haven't put the infrastructure in place to track results. And so this is going to be a timely conversation. Let me get out of this. I stopped the share, right, guys? Okay, that is gone. And we're going to dive in. I reorganized this a little bit. I want to first talk team structure, then we'll talk centralization, then new tech. So talking team structure, Mike, I think good place to start because you built, you've got a fully in-house team. Okay. How did you know? I get this question all the time. How did you know what skill sets to bring in-house? And you don't augment anything with agency, but where do you start? What is the most important? I've got a marketing lead, and then next is what?
Sure. So, I mean, I think a lot of it depends on your strategy. Obviously, if you're utilizing a lot of SEO and that's your primary go-to, you want to build that up, then you may want to look at writers or editors first, or experienced people in that aspect. There's certain things that I won't refer out, or we don't try and outsource. It got started, like most things started kind of, accidentally. You look for a freelancer or somebody that can do a task for you. The next thing you know, you have a network of these people, and it's like, well, why not just bring all this in? Or why pay an outside firm to do this for us? Do we not have the talent and ability in-house to develop this, basically? So that's really how it started with us. Same story as a lot of people, I think, that bring things internal,
Yeah.
Yeah.
And it's so core to your business. Marc, how did you go about it? You had a smaller team in dental views. How do you start looking at it? Where'd you start over there?
Where we started at is, looking at what are the biggest things that we want to spend our time on. One of the biggest parts is analytics and trying to understand what's going on with the data and trying to sub that out to somebody who doesn't understand the business. You're dealing with apples and oranges here. You want to have somebody in the house who has a feel for what's the data we're looking at, what information that we need. That's the first place to start. And then we also start from, the story that we want to tell. When we start talking about having graphics development and a brand identity developed, we want to bring those people in house, and that way they get a feel for what's going on with the business too, so they can tell the whole story. Because you can't impart everything in a creative brief. You got to have the hands-on stuff sitting in there. So the creative brief is a starting point, but if you have a feel for the brand, that's what you get when you bring people in-house. But you got to have a balance. And Mike has a lot bigger organization, a lot more stuff you're dealing with. If you're dealing with a smaller operation of 8, 9, 10 locations, you don't have the resources to bring everything in. So you got to pick and choose who you want and who you need, what's important. And some stuff you can sub out. You can sub out developing of blog posts and stuff like that, because those are quick to turn out and stuff like that. Other things need to have in-house. So you kind of got to play with that and find out that right mix and that feel.
Do you think some of it also depends on your skill set? Mike knows performance really well. You understand business strategy. Should the head of marketing also be thinking, I'm good at this thing, stink at this thing, but I know it's important to drive lead volume? Do they have to look at it from that lens as well? Does it change in a recession? So many questions here that I know they're thinking. And feel free.
You always got to look at it based on your skill set. What am I good at and what am I bad at? I want to bring on the best people in the areas that it's not my strength. If I bring those people on board, I'm going to create a successful team, because my job as a head of a marketing group is to make the most successful team possible and take care of all the issues that are our weaknesses, and take care of those and put those to the sideline and bring somebody in strong to take care of that. That's the strength of a good leader. Recognize where their faults are, where they're not strong at. That's because marketing is so vast today. To have one person say they can handle, everything about marketing is, they're smoking something. You can't cover it all. They're
smoking a lot of things in Southern California. Mike, you're more in high acute. You're high acute, right? So it's a big consideration. High ticket thing. Tell us about what you had some thoughts. I think you were going to jump into there.
No, I agree. So I agree with Marc on that. If you were to make a list of what you're good at internally, ideally you want that list to be really long. But there are cases, and knowing what you're not good at, when you need outside help, we try and view those as learning opportunities. So when we do have to contract an outside agency, I usually assign 1 or 2 people to it, to dealing with them, and say, learn everything you can. We're not paying for the job. We're paying for your education. Learn everything you can about how they're doing it, and then let's bring it in-house so we don't have to do this again.
Got it. So it's going to be like a 1-year time frame or less. You better learn everything, then eventually you can do it, or we have a significant skill. It's not scalable, right? Like the agencies work good when you're small, and we're good at a specialist thing when you're big, but the in-between is tough. Mike, were those acquisitions? I see Haven has some different brands when I land on it seems like an MSO site. Are those different brands that came with marketers? Did you have to bring them in? Tell us, what are those?
No, we either started them up in-house, or I think one of them was an acquisition that it had no marketing at the time. So everything's been from the ground up.
Okay. Marc, you mentioned that analytics was core to you. Marc actually plugged me into I can't say my favorite, one of my favorites, new tech partners in Line, which is a lead tracking, call tracking. They're phenomenal. They're great. I love Call Real, Call Boxing, but you know, don't ping me. Please still sponsor our conference. But Marc, you brought on Line, you focused, you said you brought on someone that was in charge of analytics because the business leaders like you needed to understand what drove pay. I have not heard of that being one of the first few hires. And I love that. I wish more people did that. You wanted to understand the business result.
You need to understand the business result. You got to track it through. We talk about Line. I brought Line on to help manage our whole call system, the whole thing from start to finish. We know what was going on. Before I brought on Line, we had no idea how good our agents were on the phone, how often they were closing the deals, how those deals turned into dollars, and what was going on with the appointments and stuff like that, and what was going on with each of our different social media posts and that pay-per-click stuff. So we were able to track it from Google ads to our Facebook ads to individual ads to TikTok stuff that we were doing, and we were able to understand if those things were successful, we can get out of them. I remember we did an ad on LinkedIn that we ran for about 2 weeks, and the return on that just stunk. Once we started up and going, we did not get the hits and the stuff that we were looking at, and our agents couldn't convert. So we kicked that off, and we recognized that where we were failing is that our agents didn't have the training that they needed. So this information coming out of Line told us exactly why our calls did not turn into an appointment. And then we're able to monitor those calls and look at the chunk of them and what was happening with those agents, and going back in and retraining those agents and focusing on them. And that's what I'm talking about, the analytics part of it. That's some of the stuff that you don't necessarily learn in your MBA program, learning how to be a marketer. These are the things that are on the job that you got to figure out and go, God, why isn't this stuff working? And what can help me understand that? And that's the analytics piece. That's where you have somebody, I call them a computer jockey, going in and running those numbers and telling me a lot of stuff that's going on and printing up reports. I can spend all day in an Excel spreadsheet and analytics, but I got to be working on the bigger strategy stuff and understanding how all the pieces are working. I got to have a guy feeding me that data to help make those good, sound business decisions moving forward.
Well, you got to go tell MIT this is how it's done, because apparently they missed that course in your MBA. So Mike, are you guys? Well, let's segue into marketing, technology, and integration, since we're already on that thing, on that topic. Mike, how are you proving? Because you have is it a longer cycle, or they're calling and getting. Tell us about cycle, how you're tracking all the way. You mentioned tracking all the way through to admins. It's pretty sophisticated.
Yeah.
How are you tracking? Did you get as granular as Marc saying he did?
Yeah, we did. So we typically see, within 2 days of an impression of an ad or someone seeing us in some means, we usually see a phone call. A lot of that happens at the very beginning, though. I mean, within that first 10, 15 minutes on site, we see a phone call most of the time. And then we track it pretty much all the way through. So we're looking all the way to claims, like way out into the future. So we have the data all the way through to where we can see, and there's some stuff you can do there with predictive things, but for the most part, it's just this, at this point, it feels a lot like just assembling things together so you have visibility. It also helps you with your targeting and things of that nature, but we follow all the way through. I'm a big believer in know your audience above everything else, and know what market you're in. So that's really the lens we view all of any data that we capture that way, is we view it through that lens, and how does it help us get better at knowing the audience and targeting.
Yeah. How did you track all the way through to CRM? Tell us, must have technology to stand this whole thing.
Sure.
I think it'll apply to low acuity as well. Yeah. Let's talk about it.
So what you were saying earlier, good call analytics or a good call service provider, so with robust reporting so that you can get independent reporting from that software. Obviously now it's GA4, but Universal Analytics, Google Analytics, incredibly important for site session data, what pages they were on, what they were looking at, what made them call. SEO tools, pretty much the standard there. Any major software, we utilize them all. So that, and then a robust CRM that you can kind of pull and extract data from on the back end that your sales team is using.
What CRM did you use?
Salesforce.
Yeah, it's my favorite. It's HIPAA compliant. Did you feedback admits back into the platform so they could target better leads for you guys, not for lookalikes. I understand all the FTC stuff, but did you were you feeding that back in?
To some extent, yeah. I mean, we've tested it in about every combination, you know, but I think that top of funnel and mid funnel is really where we try and stay. So we try not to go too far down the rabbit hole of targeting, right? Because if you look at an average patient journey with this, you really don't know who you could be talking to, you know, with your websites. You could be talking to a family member, you could be talking to the actual patient, you could be talking to a friend. And a lot of times that's going to change up how that looks for you, like where, at what point during this journey is this call happening, the conversion, and all that data. So I found it's better to just focus on that upper part, you know.
Build the demand, get lots of, so, okay, we're going to talk upper funnel advertising. We're going to talk patient acquisition and don't worry guys, we're going to talk patient acquisition to the future as well. Okay. To the future. What the fuck am I saying? Towards the end of this webinar. Sorry guys, this is explicit. I don't know if y'all got everyone. That's great. Marc, favorite technology. Marc's one of the more innovative partners we've ever talked to on the tech side. I love it. What else, Marc? What else did you love to prove the business case or to track marketing efficacy?
Well, the other thing that we were using was a good CRM system and being able to track them coming through. And being able to understand all the dollars that are coming in with them. So the CRM was a system we were able to check all the way through our PMS system, our patient management system, and be able to understand how many dollars that are coming back in through the funnels that we had going on with the patient journey.
Okay. So
we really want to understand that, because at the end of the day, you start with 1,000 leads. And when we're doing practice and like all on four stuff that we were doing for full mouth restoration of teeth, you know, we might have 1,000 patients come in or 1,000 customers, patients come in. At the end of the day, we only have, you know, call it a dozen to, 15 of them that turn into actual dollars. And the lead time on that can be forever. I mean, from the time they start seeing our ad to the time we bring the dollars in, could be 60 days or even longer before we start to see that return on our investment. So you got to understand how long that journey is going to take and what's going on. Because we have in dental practices, you have different things that are happening every day. You have, restoration that's going on. You have cosmetic dentistry that's going on. Then you also have your general cleanings and your general patients that are happening. So those dollars and those times to go on take time to get that revenue in and understanding what that's going to take. And you want to keep hitting those patients to come in. And the other part of that journey we got to talk about is to make sure you get rid of the buyer's remorse or the patient remorse that happens. To making sure that it's retargeting them and getting the data back out to them or getting the ads back in front of them, and also hitting them back up with getting good reviews from other patients. Let them know they made the right decision and that things are actually they're in the right place, and we're here to take care of them. And that's the information that we really want to get across. We want them to feel comfortable with what we're doing and how we're working with them.
Reactivation, very important in the dental space. Mike also, or you don't want to see them again, but do you want to help educate them through email ongoing, direct mail ongoing, so that they see you, they tell their friend that might be having trouble? What, anything that you do CRM for?
Yeah, so we really beefed up our alumni presence in the last couple of years. So now they do recurring all the locations, and pretty much every state they do an alumni event every month. We stay in touch. We have a newsletter that goes out to them. All of that's been fairly recently created. And to your point, you never want to see a patient back for this in particular, for mental health or behavioral health. We hope that we don't. But it is about building that community, and to some extent your brand is about that. It's the follow-up, it's them seeing other testimonials from people a year, 2 years, 3 years post-treatment, and it's about staying involved with them.
Yeah, and some substance abuse have like a full continuum of care, so maybe they want ongoing therapy and stuff. So guys, I'm now reading the questions that Carly sent to me on the side. Thank you, registrants, for sending questions in on the side. How do you, I saw 2 or 3 came in that were CRM related, but also investment. You guys made the investment. Your CMO, you were both CMOs. A lot are not CMOs, the marketing directors or VPs, but they're not on leadership team like you guys are. How do you justify, how do you get them to invest in these technologies that are critical, but not like revenue generating from the jump. Can you, any quick tips? I don't think there's a quick solve to, what do you tell the business leaders to make them invest in CRM and all this fancy stuff y'all are talking about? Mark, go ahead.
What you got to look at is, what is the payback and how are you going to get your money out of it over time? Okay. When we did, I come back to the line example. We took out, how much time is it going to save us from what we're doing today to when we put line in? And we were able to justify it. We can pay that off in a year just in the labor savings that we were getting off the line. When I was talking about that, trying to analyze the data, having my call center agents fill out information in the computer system that allowed us to do better, allowed us to track stuff. Yeah. We're able to eliminate 3 or 4 minutes out of that time that they spent after a call before they could take the next one. That adds up over time. And then we were talking about then all the other information going on. Okay, now we understand why we're not getting the calls. What can we do to retrain the agents? And we're able to see a return on our investment real quick. And it's really when you talk about how to sell it to upper management, what is the return? What's the savings and how it's going to speed our process along to make it better? Because investing in technology is tough because there's not always a return that you can point to today on. And so those are some of the things you got to talk about.
Mike, go ahead, and I'll clue into something you said there. Mike, I'll take a mental note. Go for it.
Yeah, no, I agree with Mark on that. I mean, it's a value proposition, so you have to state the case why this is worth investing in, how it's going to enhance operations and efficiency. But it tends to be, look, with marketing, there's something always that needs to be spent on in marketing. If you can generally find a very long list of things that you can market. You can market into oblivion. So I think combating that sometimes is important, just being reasonable with your spend, being reasonable with your approach and your delivery of how you're explaining what it is we're doing. Because a lot of times there's the view that it's like just pump more volume and it all fixes itself. And, there's a lot of efficiency gain that can happen with tech.
Yeah, and something now, both of y'all have now said it. It's not marketing tech just to benefit marketing. The right technology actually helps inform operations, right? If you find out the call center one agent stinks, guess what? They're not just taking marketing leads, they're taking leads that are word of mouth referral, and they're not booking into patients. The right marketing tech helps them understand the ICP and how different demographics are converting and what they care about. So I think that's helpful on the sales too thing. So Marc is right on both accounts. It's a return on investment. How long is it going to take? And how will it improve the business, not just get more leads in the door from marketing? So I love that. Hopefully that helps the listener. Actually, I'm going to make some more content around there. How do y'all, so Mike, you've got a bunch of different locations, brands, and Marc, you've run big groups too. We got a few questions around this, and it's the main theme here. How do you centralize marketing ops? Do you allow them from acquired brands in your previous lines? Do you allow them to be spread out? Do you bring everybody under one? How do you do this efficiently here in this fun recession we're in? Any tips there?
Yeah, I think that the go-to is obviously unified brand. It's having a corporate brand that can offload some of those costs and gain the efficiency across a national scale. Our approach and kind of our view has always been that, or my view has been, let brands be brands. So if you have, for example, a Midwest brand, do you really want the same strategy or the same approach that you would use in the Northeast? Probably not, right? It's totally different market. So in terms of how you're implementing it, I mean, you really just have to kind of silo to some extent, but also maintain that centralization. So make your list. What are the positions I have to have down the hall from me, right? Okay. And then what are the positions that I can have elsewhere? So we've become pretty good at that because we maintain these brands in different markets and try and keep some separation between the corporate level and what's regional. And we'll go as far as to put a satellite office in that market that we have people out of because they're from there. They understand the market. They know the towns. They know everything about it.
Yeah.
So it's important to keep the local flavor. Yeah, Marc.
Yeah, I agree. But it also depends upon the brand. If you have a national brand, let's call it Aspen Dental, who's kind of the same thing across the board with everybody. their message is a little bit different than what we were at Dental Views, where we're very specific to our region. So you have regional dialects, regional conversations that are happening, things that are happening regionally that you got to speak to, than you have to as a national brand. I think your marketing idea changes when you have sub brands underneath the parent company. And it's very different. And I think Mike is right. Each brand has its own identity and its own type of way of talking to patients. And you got to keep that going. If you try and meld that all into one, you become nothing to everybody. Every brand has a character, and people play to that, and patients want to go to that character or to that brand. So having that individual voice is important.
Yeah.
When you're trying to be everything to everybody, you're nothing to everybody.
Yeah,
No
you
one
got
cares.
to,
Yeah.
you got to know your ICP per market, and then you have to speak the language. We can tell if you say pop in some ads here down in Atlanta, or you mention Pepsi, you're done, dude. I'm not going to. Yeah, so understanding the local flavor and having, both of y'all mentioned having brand in house. Now, brand in house can be brand in office or brand in satellite, but as long as brand is understood by someone in the company, I guess that sounds like that's the key from you guys. Okay. All right, I got it. Got a side question I want to ask you. What percentage of revenue should be dedicated to marketing? Just side note. What do y'all think?
50%.
All right, I thought so too. For us, it's 15, and we're on the high side. I'm curious.
No, I'm joking.
In medical, what is it for you guys? Agencies, 50%. We're on the high side.
How fast do you want to grow?
Yeah, baby. Yeah, baby.
You know, I mean, yeah, 20%.
Yeah, 20%. I love that. Yeah,
20% to keep growth going. And something a lot lower if you're just trying to maintain where you are. It comes back down to what is the profitability of the organization and how much dollars they can put into it. That's what it comes down to. I mean, typically marketing is anywhere from 10 to 12% to keep everything where you are. Okay.
Yeah, lifestyle business. Not fun.
Right.
Yeah,
So if you want to grow, you got to throw the money into it. And Mike's right. It's about 20% of revenue. And that can be hard for organizations to bite onto. And you have other issues like operational stuff they need to buy, equipment they need to buy at operations. Oh, let's not ever forget about hiring the personnel to go along with it.
Yeah. And hygienists expensive, therapists expensive. Yeah. Reimbursement's not up, wages are. And so tough pill to swallow. But Mark, Mike, I think that's a cool question I had a marketing can ask before they take the call or take the job at a group. Say, what do y'all spend on marketing? And that's going to tell you if you're going to be well supported or if you're just going to be pinching pennies and bullshit lifestyle supporting the CEO's lifestyle. I'm not saying that's what we do here. Got a question in this chat. Both of you mentioned and you've gone into new regions. How do you build trust in a new geographic region if you're a national brand? Well, maybe not a national brand, but you're in a new geographic area. How do you build trust? Mike, you love it seems like you love top, middle. Mike, Mark, whoever feels like jumping in. What are some of the, let's talk tactics. What do you do to get in there and establish trust if you're not doing an acquisition? Maybe it's a de novo and somewhere new.
Yeah, I mean, I think, digital outreach is a huge component of it. Way before we move into a market, we do our research, start building a list of who we need to talk to. And then we couple that with hiring some people from the area on the ground. So half of our team is digital, the other half is in the field. So those reps that are in the field, getting someone local who knows all the people already, knows the organizations, knows who to go talk to is critical. And getting in front of the right people, letting people know you're there in the community as a resource, doing like a scholarship fund or something when you're going into a new market as a olive branch or a measure of goodwill that you're here to help the community. There's a lot of things you can do. I tend to go on the grassroots side of things with that. I like stuff that makes people think fondly of you,
Yeah. So getting the liaisons locally. And Mark, how dental different? I assume
dental is not that. It's not that much different. I mean, I believe in the field marketing activities when we're moving into a new area. So I mean, dental offices generally operate anywhere from 5 to 10 mile radius of the offices they put in. So if you get involved in the community in a field marketing operation, that's simple things, supporting the local little field, little leagues, getting your name out there, getting involved in health service stuff that's going on in the community and through the community service organizations of the cities and stuff like that. Trying to build your brand that way, one-on-one. It's a little bit of work, but it's really kind of simple to do, and you can start building people up. Because what you really want to get to, if you can get to word of mouth marketing, I can stop spending money on digital, which can be expensive. I can get word of mouth, and that's cheaper to go.
Yeah.
At the end of the day, I can start getting my brand out that way.
Yeah,
and I think field marketing is an important part, and that is old style marketing that a lot of people aren't thinking about. Like, oh, I can take care of everything digitally. And I'm like going, oh, that's just a component. Digital marketing is just a component of the overall marketing philosophy and the whole marketing mix. If you got to look at the whole marketing mix and everything you're doing, not just digital, but traditional advertising, out of house advertising that you're doing. And, and also some of the things you can do is over the top TV, on advertising on places like Sling and stuff like that. Now, when people are starting to disconnect their cable boxes, you can actually go into Sling and you can actually run all the metrics that way and understand what's happening as good as you can with things I'm doing over Facebook and stuff like that. And the other thing I like is actually out of house advertising or billboards. There's a lot of metrics now running around when people are running around with their cell phones. Yeah, I know when they go by my ad, and then if they show into my office, I can actually start seeing a return on that. I can start understanding those dollars that I have coming in. So there's lots of different other things I can do in a community to help build up my brand name and build awareness. And that's what I'm trying to get to, is top of mind awareness. Direct mail is another one of them too.
Does it still work?
Direct mail still works. It still works.
For getting new ones or reactivating existings? Or both?
For me, it's both. What do you think, Mike?
We don't use any direct mail.
It's not. I would imagine. Hey.
I think it depends what you're in, though.
You look a little sleepy. Hit us up. Had a question here. Tips for launching regional teams aligned with the national brand. How do you onboard new field teams quickly? So you both talked about that. What is that? Just bringing them out and ingraining them in the culture and hoping that they stick. Do you get only regional teams that have connections with referring providers, senior care? How do you get these regional teams and get them aligned quick?
I think from a regional standpoint, it's bringing them in and training.
Yeah.
You bring them in and indoctrinate them into your culture of the organization on the marketing side, on the operations side, and bring them all the way through. And you partner them up with a more senior individual that helps aspire them. And then you also got to hire the right talent to begin with. It starts from the beginning. Did I hire the right person who gets what we're doing in the conversation? And that's what I look for when I'm hiring team members. Do you get what I'm doing? Do we connect? We may not know everything or know everything about you, but do you connect on the strategy or the philosophy of the business and how we operate? I worked around the country. And I'm born and raised here in Southern California. And I'll tell you what, my idea of managing is different than probably Mike's is out from Florida, than different from guys out of New Jersey and New York. I clash sometimes with people from that part of the country. And I'm like, dude, let's get it done.
Everybody does, Marc. Everybody does. Don't worry about it. I like the no fuck around of the North. I hear you. So it depends on the region. Get them in, get them trained. You mentioned upper funnel advertising, out of home, connected TV and billboards and stuff. I love that. We're starting to do a lot of media planning. We've been touching on it, and now we're doing full media planning for a lot of our clients. And I think a hesitation a lot of performance marketers, like the three people on this call, have is how do you prove it? And you mentioned some downstream ways. Mike, you guys do a decent amount of upper funnel advertising. How are you measuring that stuff? Is it like search impressions and clicks for brand terms came up, or we can track admins who can't from an ad impression? How do you justify some of these upper funnel tactics?
Sure. So, get it as specific as you can, obviously. We don't tend to do billboards or like blanket brand coverage. That's actually comes later usually. So towards the end, consolidation phase. But in the beginning, just a lot more targeted, high intent, looking for exactly what you're offering. It can be brand or category, depending where you are and if people know who you are. But still getting it as top of funnel as possible, but also as targeted as possible and eliminating waste.
Yeah. You got to be real clear on your ICP and where you should be advertising in that market. Go out to that city and check it out, my friends, before you run into tons of upper funnel. Don't do it from your central station in Columbus, Ohio, if you're advertising in Atlanta. Marc, I know we're tired of the AI shit and hearing it left and right. You guys using an innovative ways for marketing? Is there any Any level up here that everybody can hear? You guys, your teams, are you making them use it? Are you using it for anything? Force multiplier, anything? Do we have any quick tips there?
AI is going to revolutionize the way that we're doing marketing. I mean, when a chat GTP came out in November, we started playing with it in the dental views. And I asked my team, hey, how can we use this to help us at least writing, starting with our writing prompts, our blogs, and our posts and stuff like that. For us, it's not, didn't do 100% of it, but it was a good starting point for us to add and change things around. I think as AI learns, it's gonna be a lot different. Yeah, I've used it on the website for my own organization, for DSO Marketing Xcelerator. We use that as a way to help add another person, I hate to say, to the
What do you mean,
mix.
chat as in like answering prompt chats, or it wrote the copy, or it designed the site? How'd you use it?
I use it to help design some of the copy that we have going on.
Yeah,
And I rewrote it. It wasn't what came out the first time, but you know, you use it as a way to start anything. Just like, you know, marketing is a collaborative sport. So, you know, it doesn't, if I have one person do something, it's not the best way. Having a team of people come together with something, I'm going to have the best thing possible. And that's the way AI should be used too. It's a starting point. It's not the end all, the be all. Just like all technology, it all gets molded into the way the organization needs it and how we use it. And I think it's a big individual for every company and every person. What do you think?
Everybody
Mike?
start tinkering. I tell the team all the time, AI is not going to take your jobs, but the human that knows how to use it is. Mike, do you use it for anything other than copy prompts, copy ideas?
Yeah, so we have development and marketing. So we've had API access to GPT-3 since they released. That's over 2 years ago.
Damn.
And we've been messing around with it, experimenting, and obviously it's a big topic of discussion right now because they released the chat bot, basically version of the AI. So you have these large language models, but I think the value, it's not necessarily where you would think it is with these things. So content was getting really expensive, you know, but the need for content and demand for content over time was obviously increasing. And then I think now you're seeing the opposite of that. You're seeing the bottom fall out of it, right? But a lot of people are thinking, oh, I don't need my writing team, or I won't need my graphics team. And I think if you've been around a while, you may say not so fast, right? Because the natural progression of these things is if this is integrated into search engines, well, how is a search engine determining what the answer is? It can't generate things all the time. So there has to be input of fresh data at a certain point. So right now, they're not connected to the internet that much. As it becomes more and more there, I think you're going to see the value of content start going back up. So human generated content. So I think it's going to come full circle. I don't think you'll need as many people as you needed before necessarily, but I do think it's going to come back full circle to where you're going to need that original content at some point because it can't all be AI generated.
Yeah.
Right?
Or we're in a boat of sameness. And then how does Google, it's all the same shit, no unique.
Exactly.
So, and when Mike said like human generated, how it's going to know is unique research point of view. I have it do a decent, and you'll see some of my LinkedIn posts pretty active there. And I have it try, I'm like, all right, I'm sleepy on a Monday. Like, give me some inspirational shit I can post. And it gives me like stuff that does not sound like me at all. And I know it's all on the prompts, but I'm like, sound irreverent, sound like an asshole, sound like Alex, you know? And so don't get rid of your writers. I know the writing guild over by you, Marc, and on the left coast is striking. You can't get rid of them. You can't get rid of designers. Like, I think it's a force multiplier. Guys use it. They need to use it, but it's not going to write like a script for a movie with cool, with cool personas and unique.
It can't.
No, it can't yet. Now, does it take all of our jobs in 5 years? Yes. Enjoy the next 5 years, guys. That's probably where we're headed. I think everybody's got to become more strategic, understand how to integrate tech and become more creative. Hands work, tactical work, guys. It's going to take those white collar jobs. I mean, I think there's no doubt that that's where that's going. You have to understand how to use the AI.
It's not going to take it's not going to take our jobs. Our jobs are going to morph into something else.
I hope so.
And that's going to happen. Marketing is always going to be here. Everybody's going to need marketing. And stuff and be marketed too. So it's just going to morph into something different than it is today. Just like it's morphed from where it was 30 years ago.
if your job is hands-on keyword tactical work, I'm worried about that. I am worried about that in the next few years. Always marketing and advertising. Minority Report. How do you think Tom Cruise is being served this and that? Like, it took someone to figure out he's the ICP and serve him the ad in the subway. That will still exist. Mark's right. Let's talk about my favorite thing, patient acquisition, and how do we scale that? We've got high acuity on the line with Mike. We've got low acuity. Marc actually has both because he has the cosmetic side too. So it's kind of a nice blend. Mike, start with you. Marc, you just last went. Talk to us about your favorite patient acquisition channels.
Sure. So pay-per-click, and then obviously referrals. So referrals coming to ground reps that are out there. I mean, I'm a big fan of print media, and I know that's crazy. I mean, a lot of people these days, they say kill it, but I think it's more of the they say kill it, but I think we're actually spending more. We're actually spending more on print media than every quarter, basically, for the last 2 years. And the reason is just finding the ways to blend that in. It's the lowest cost. Handing someone a brochure and having them call from that brochure you will not beat it in terms of how cheap it is, you know. But on the digital side, local SEO, letting people know we're in the area, patient reviews, testimonials from locals that are there, building the brand around it in the community, and then some pay-per-click.
Yeah. And PPC. Thank you for calling it pay-per-click, not Google Ads. You can tell who's been around a minute when they don't call Google Ads. Yeah, it's SEO, PPC, brochure. So print definitely still works, guys. I asked direct mail because people don't. It doesn't help me to say it, but all of that stuff still works. And we'll get back to best PPC tactics. Marc, your favorite?
You know, my favorite happens to be advertising on television and on over radio. I mean, these are some of the things that old is new again, believe it or not. I mean, it's a thing that you have people's ability to talk to them while they're sitting in the car, while they're sitting on their TV or sitting on their computer, and watching stuff now. And that is the most visual impacting of them. I know everybody's on pay-per-click and you know, social media and stuff like that, but I'm not paying attention as much to social media as I used to when it first started. You know, I'm like going, shut the freaking ad down. I'm tired of seeing that stuff, and I want to get them off of my LinkedIn and off my Facebook and stuff like that. Let me get to what's important. I'm only there for me. And then it's also really looking at who's the group you're trying to go after. I mean, the demographics are really important. You know, so what's going to connect with that demographic? So if I'm going for a younger demographic in the 18 to 30 range, TikTok may be the place for me. If I'm going from the 25 to 40 age group, you know, a little bit older, you know, it might be Instagram. You know, the 35 to 60 age group is Facebook. So it's understanding what's going to get their attention and what's going to happen. So I find I love the challenge of trying to talk
the enigma, the puzzle. The puzzle.
You know, what's going to work, and all the pieces are going to come together. And I think that's what makes for a good strategy, is understanding how those pieces are going to work and how you plug and play all those pieces to move forward. Yeah. You know, the older age group, you know, 45 to 50 year old homeowners. Mail advertising over the mail and having to come in their house is going to get their attention because, they don't get very much of that anymore. So now they're going to see it. You know, I get dental ads all the time here at my house. So
because you keep saying dental around the thing, dude. I'm creeped out by my phone. I keep getting ads for things that I wish I didn't know about. Very cool. So old is new. You know, it's funny, when digital came around, I bet all the ad agencies pivoted to becoming digital agencies or had digital arms. And it's like, actually, we're now all becoming ad agencies where the creative is what helps you stand out, because we're oversaturated on fucking digital impressions all of the time. So I'm with you there. I think going back old school, I think there's ways to blend it. Digital out of home, digital billboards, connected TV. Those are the nice measurable things. But like Mike said, print brochures still work. Guys, side question before I talk about getting your providers. For referrals, are there any way, I got this question, to get more ACP referrals, are there any ways to assist your liaisons and field teams with digital activations? Is it other than like putting the list into ad? Like, is there anything? This is a question I just got from a client. I didn't know how to answer it. We don't do it. So any clever ways? Do y'all advertise to the list or email them, or what? You have any thoughts?
Yeah, so we do all the above, basically. I mean, our in-house digital team works with them. So if we do outreach campaigns for like market entry or backlinks or anything like that, we pass along anyone we're going after the same places that they're going after usually. So We pass along anyone who's interested and assist kind of the ground team with that. I like to think of your digital versus your ground team as kind of like your Air Force versus your Army. Basically,
ground
you're there to provide air cover and
cover.
support so that they can get the job done on the ground, basically. And we approach it that way. Other things like the print media, we put specific tracking numbers for the reps so that that doesn't come in as a Google call or an organic call. It's tracked directly to that brochure that's only for that rep in that area.
That was the question we just saw in the chat. How do you track ROI from print? There you go. Yeah, you have it, Mark.
Everything has a specific number. I mean, we had, 80 or 90 numbers going on for all the ads and everything that we had going on. So we knew how each ad performed. And today, numbers are, ubiquitous. You can get a ton of telephone numbers, for everything you're doing. There's no reason why you can't track everything. From billboard ads, from television ads to pay-per-click, to mail brochures. I mean, everything has its own specific phone number, comes in, you track it, you know exactly what's going on with it.
Good lead tracking, good CRM, keys there.
Exactly.
There's no way to get more budget. There's no way to get more budget and provide more air cover if this year you didn't track everything. Yeah. Impossible. Do you guys ever get the Mark? Dental Views was provider owned, but either of you guys share, like, did you get Dr. Z, Mike, have you ever gotten the providers involved in content, or does it always just stop with them? It's a cool idea and then they fucking don't do anything on month 3 and they didn't contribute. Is there any creative ways? Have y'all gotten providers involved, or just never, the bandwidth is never there?
Yeah, I mean, I find you need the right person for that job. So you need, like, for example, I think Carly does the webinars, right? So you need the right person to communicate with those people and say, hey, this is what we're trying to do, right? We're not trying to put you everywhere. A lot of physicians I find are they're against social media. They don't want to be seen on social media. Okay, well, we're not putting you on social media. These are the channels we're putting you on. This is what to expect. We'll try and break them in kind of easy with it so that they're not, shocked by it. And then you'll find they actually start, they're helpful. I mean, we had a case with a provider a physician we used. We didn't think she would be about it. And over time, one day I was on LinkedIn and I looked, she had shared this video that wasn't even on the company's LinkedIn, right? She found it on the YouTube, which is like a warehouse, right? So she found it on there and saw that we had posted it and shared it. And I told the team, I was like, that's what you want right there. Yeah. You want that level of buy-in where the provider is caring about sharing their expertise.
Yeah, they have unique perspectives. Yeah, Mark, what do you think?
I mean, one of the things that we did is that we had at our office level, we would have our office managers take video and post them on TikTok for us. We gave them open access to be able to do that from the providers. We just did something with Dr. Z a couple months ago. Also, we put together some new advertising and stuff like that we're running on Facebook and stuff like that for some new videos that we have happen. So I think it's important to get both the leader of the organization who talks about the benefits and the services they provide and kind of give that, I'm the guy to take care of you. Then the local people, you kind of have two strategies. And as I always call it, I had a global strategy and I had a local strategy. And the local strategy, I put the office managers in charge of, because we didn't have regional marketing people in there. So hey, put your videos and here are the things you need to have to make that happen. So you need to have our logo and here's where it needs to be. You need to have the phone number. This is where it needs to happen. And this is how long you need to do, and you can go ahead and post it. Oh, and stay within these guidelines because we know it. I'm going to slap your hand and we're going to have a conversation later on. So, but if they put all those pieces together, you let that happen and you have somebody who knows. I mean, it's making sure that you have the people who have buy-in to it and they understand the importance of what they're doing. And a lot of people love to post social media. I hate to say a lot of the younger generation. My younger marketing team members love to do that type of stuff and like to get it out and they understand the value of it,
no way around it with this this valley of ocean of sameness from the AI content. The providers have to start contributing. Like, I don't know how we're going to stand out when every marketer's got tons of AI ChatGPT bullshit out there. Like, we need the providers involved. And I think they say no, but then they kind of like love it, and they're like, all right.
It's a love-hate relationship. Yeah. I mean, it really is. I mean, if you don't want to get your name and face out there, it's a hard thing, but then you want to get patients in, you want it. and grow the business
Yeah.
locally, you got to get your hands dirty. You gotta be
Explain
out
the
there.
business case. Explain the business case. Hey, ChatGPT, there's a ton of sameness content out there. We really need your unique perspective. I get you're a physician and you have the ego that goes along with it. You don't want to cheapen your advice, but you want to grow your practice, right? Okay, so let's get rolling here. I'll allow a few more minutes for questions to come in. If they don't, I have one more question for each of you. Marketing trend. We're in May of 23 here. Any big trend? We talked about AI, so we're not going to mention that. Is there anything that you guys are really excited about, or the same kind of shit, but you're investing more into because it's really working? Marc, anything big that you're excited about?
You know, I'm really kind of turned on by the new advertising metrics going through like Sling and OHH, as they call it.
Okay.
You know, advertising over people who are unplugging their boxes, their cable boxes,
yeah,
and going this route to streaming their television advertising, because the pricing is so inexpensive, and I can be very specific to the right demographics or the right area. I can go right into zip codes that I need, and it becomes a lot less expensive. I mean, to run television on even in Southern California, it costs a lot of money.
yeah.
But I can be very regional to Riverside, very regional to Newport Beach, very regional to the cities that I'm in by zip code, and run ads that way. And I can be a lot more cost effective and get a better return on my investment. And that's the thing I really love right now.
And Marc, real quick before I get a mic, when you're running OTT, do you expect it to increase brand awareness with a downstream effect 6 months later, or do you expect to get surgeries or general dentist patients?
It's gonna pick up right away. What I'm expecting, when I say that, it depends on what the services we're talking about. So if I can start seeing revenue within 60 days from that, that's what I'm looking for. The other part of it is you want to have, keep top of mind awareness or TOMA going on, and digital advertising in lots of different ways, and going through Sling and stuff like that is a way to help that. But it's just keeping awareness. It's where they all are in the buying cycle at all times.
Good.
Mike's business is a little bit different than ours, because I always got to have some repetitive business coming back from those patients. I'm expecting them to come back every 6 months.
Yeah.
To get a teeth cleaning and stuff like that, and the crowns replaced, and we always have teeth issues going on. So
yeah. I know. I gotta get to the dentist. It's supposed to be Memorial Day. Yeah, I love it. Thank you for investing in over the top. I appreciate it, because performance branding matters. That's what I'm coining it. That's what we're going with. Mike, anything you're excited about?
Yeah, I think more of a kind of a larger strategy for the rest of the year. I mean, it's a lot of back to basics, it feels like these days. There's so many changes kind of happening at the search engines and how information is presented to people, that focusing on what feels like the right strategy, if that makes sense. So to your point earlier about your expert content, right? Your physicians, your own internal resources, I think are going to become more and more valuable as the year goes on and into the future, because that is unique to your brand. So that's content that you can put out that can't be diluted, right? And the AI can't make your doctor appear in a video, right? So with your logo. So I think the more helpful you are as a resource, the more value you're going to see in the coming years.
Unique and valuable will win over the next few years, because the AI can't do that. Mike's absolutely right. And sometimes we don't need the flashiest new trick. Maybe it's just going back and making sure SEO is going to work with the changes that are going to come, that people are going to enjoy the UX and the patient experience. Marc, Mike, thank you so much for joining this roundtable. This is very fun. You guys shared a lot of expertise. I love that. We're talking about the business result that you need for marketing, how to get your leadership team to invest in. We talked trends. We talked about bullshit API stuff. This was real fun. Thank y'all both. If you want to find either one, go to LinkedIn. They've been very helpful. They were responsive. That's how I snagged these superstars. Go to LinkedIn, Marc Heffner, Mike Hulick. You'll find them there, and they've been very generous. They will be with you too. Thank you both.
Thank you very much, Alex.
Thanks for having us.
Pleasure.
We're about to play. We got Madrid playing in 7 minutes. Let's go watch the game, boys. All right, I'll talk to y'all later.
All right, there it is.
Bye-bye.
Thank you.
See ya.